Hello dear friends, this is a case of a 64-year-old female patient, non-diabetic and known to have ulcerative colitis. The patient presented septic with diabetic ketoacidosis, high inflammatory markers and acute kidney injury AKI grade 3. We will discuss this finding, but let's have a look to the whole abdomen. We can see that there are some changes in the large bowel due to the non-ulcerative colitis. First of all, there is haustral loss. There are some mural changes, some thickening, and some areas of mild pericolonic fat stranding. This is the descending colon. Some mural changes are also seen in the right colon. Wall thickening and mild pericolonic fat stranding. Now let's discuss the finding. We can see that there is significant deformity and gas bubbles in the T12 vertebral body. Some gas bubbles are extended in the paravertebral soft tissues, and most importantly, there is significant gas into the spinal canal. There is also some gas in the soft tissues in the left lateral thoracic wall. This is an extremely rare case, so please stay with me to explain you some of the findings. Here is the images in the pulmonary window, so the gas bubbles can be seen better. Here is the sagittal view. We can see that there is significant loss of height of the T12 vertebral body, and we can see also the intracanal gas bubbles, which are extended beyond the field of view. In pulmonary window again, we can see the extension of the intracanal gas bubbles and the intraosseous gas as well in the T12 vertebral body. Zoom in to see better the finding. This is a CT scan of the abdomen and pelvis of the same patient 1 month ago. Here is the T12 vertebral body, which looks normal. There is no evidence of any pathology. So the findings are acute. In the previous CT scan, we can see that the mural changes of the large bowel are chronic. Here is the large bowel, the left colonic curvature. Let's go down to the descending colon. And here is the right colon. And the transverse colon. According to the findings, the appearances are in keeping with spontaneous emphysematous osteomyelitis or spondylitis, and this is a significantly rare case, but with high morbidity and mortality, and it is infectious disease sustained by gas-forming pathogens. To my best knowledge, up to date, only 35 cases have been reported in the literature. The mean age of presentation is 51 years of age, and the most common predisposing risk factors are acquired immunodeficiency conditions, diabetes, corticosteroid therapy, hematological diseases, malignancies, HIV infection, and alcohol abuse. The possible causative organism usually belongs to the bacterial families of enterobacteria or anaerobes, but Klebsiella pneumonia or Fusobacterium necroform have also been described in the literature. This patient has a double risk factor: first the diabetes and secondly the ulcerative colitis. As you can see, imaging plays a significant role for the accurate diagnosis and the extent of the disease, and in this case we can see that there is extension in the spinal canal, and this patient probably will undergo a CT scan or even MRI of the head to see if there is any pneumocephalus. There is a high risk of spread of the disease in the central nervous system in this patient, and this should be mentioned. So further evaluation and investigation should be done. Dear friends, thank you for watching this extremely rare and interesting video and presentation. If you like my videos, you can consider to subscribe to my channel, and you will be notified the next time I upload a new video to my channel. Thank you again, and see you soon.